Hi, thank you for joining us for this Clackamas County Emergency Operations Center update for the week of November 16th, 2020. I'm Kimberly Dinwiddie, the county's Public Information Officer, and today I am speaking with Clackamas County's Public Health Officer, Dr. Sarah Present, to bring us up to date on the COVID-19 pandemic now that we're in a 2-week freeze. The state mandated a 2-week freeze starting on November 18th. This freeze limits in-person gathering sizes to no more than 6 people and no more than 2 households. It closes gyms and other facilities, eliminates in-person dining in restaurants and bars, and allows only takeout service at restaurants. So Dr. Present, how did we get to this freeze and what does it mean for Clackamas County?
It's nice to be here with you, Kimberly. Thank you for asking me. We in Clackamas County are seeing really similar dangerous, huge spikes of COVID-19 cases that the rest of the region, the state, and the country are seeing. In the summer months, we were averaging 100 to 150 cases per week. In early October, we got to 200 cases per week, and we are now at 676 cases last week, which is over a tripling in a 3-week period of time. And a lot of that is due to people moving inside during the colder months, I believe. There are a lot of spread in known indoor gatherings, whether they be social gatherings or workplaces that are not following the COVID precautions that we know do prevent spread.
This is no time to get complacent. We saw early on in the pandemic how staying home really helped flatten that curve so we didn't see that our hospitals were meeting capacity. So we really should be keeping up all of those good COVID habits that we've built over the past 8 months, shouldn't we?
We really should. We really do need to get a handle on our case counts and shift gears to get these numbers under control. If we don't, our hospitals will be overwhelmed, and I know that they are already quite stressed, as are our outpatient clinics and our testing capacities. We need to really be staying at home, interacting just with our family as much as possible, teleworking as much as you can. And when you do go out, wear your face covering, wash your hands when you get home, and take all the precautions that we know do work so that we can shift gears and decrease the numbers.
So Thanksgiving is next week, and many of us will gather with our families at home. But the spikes in cases is due to small gatherings in the homes. Is that right? And what can we do about it?
Yeah, well, the number one safest thing you can do is to have a virtual gathering or celebrate with only the members of your own household. If you do have other gatherings, we really ask that you limit it to no more than 6 people or no more than 2 households, and this includes indoor and outdoor gatherings. Some other things you can do: designate one person to handle the food. Make sure you have wash stations so that people can wash their hands frequently and have hand sanitizer. Keep your safe distances. Increase air filtration or air circulation in your home, and really get creative and consider assigning seating that's 6 feet apart from each other. Wear your facial coverings when you're not actively eating or drinking. Some of the things that we're doing when we're going out into public to prevent spread, we need to do those in our homes during these gathering times as well.
Great advice. So this is also a time of year when many people travel. Oregon, Washington, and California jointly issued a recommended travel advisory. What does that mean, and what should people do?
So the recommendations are, if you travel interstate or certainly to other countries, we know that this spike in cases is happening everywhere. So if you do travel, then when you get home, please quarantine at home for 14 days. That means not going in person to work. That means not doing any non-essential travel. And if somebody else can get groceries for you, etc., then do that so that you can limit your exposure to others as much as you can, and try to keep our spread local, and so that we can contain it and control it.
This is good advice. Thank you, Dr. Present. There's a lot going on, and there's a lot of information out here that can help you. You can visit our website at clackamas.us/coronavirus to learn more about what the freeze means and how to protect yourself and your family. Please keep your guard up against COVID-19 so we can keep our businesses open. Thank you for joining us, and we will see you next week.